Hello, this is your nurse Edwin again, and this is my third vlog. So, for this vlog, I will be talking about the life of a nursing student. So, this is based on my personal experience, okay? So, we all know that nursing can make for a great career and educational pursuit for the right person. If you've decided that you are that right person, then you may be curious as the life of a nursing student. Such knowledge can better prepare you for the road and years ahead, which can go a long way towards success and satisfaction as a nursing student. Here's what to expect at nursing school. I have six expectations. Six expectations. First, clinical rotations. So usually your clinical rotation starts when you are in second year. You're expected, the focus of study in second year is more on health promotion and prevention. So I'm expecting that you will be exposed in either health centers or community. And then third year will be the focus of study will be on operating room, med surge, reproductive health, mental health. So expect that you will be exposed clinically on the different affiliating hospitals like mental hospitals, San Lazaro, Fabella, or even in the hospital. That's another thing. So the second expectation is that the life of a nursing student is about balancing or managing your time. I'm not saying that you should set aside going out with friends. That's fine. I've been doing that when I was a nursing student. However, you have to make sure that you do prioritization and time management. I always make sure that I finish all my assignments, projects before going out with friends. That's really a given that you really have to prioritize your study. In nursing school, the third one is you will likely feel overwhelmed. Why? Because you will be asked to submit assignments, projects, nursing care plans. This nursing cases really suck when I was in the nursing school. Why? Because right after your clinical exposure, you will ask to identify problems that you've identified in your patient assignment. Like say for example, you identified three problems. So then you are expected to submit three nursing care plans on top of your assignment, case presentation. That's how very overwhelming if you are a nursing student. Nursing student number four often spend money out of pocket, especially in my case. During my entire nursing education that I don't have books. So I resort more on photocopying books that I borrowed from library or from my friends. That sucks, right? Because I could not afford to buy books. And then number five is nursing involves a lot of reading. That is really true because you really have to expect to read books, journals, or something like that. That you better prepare for the class recitation, which is expected really as a nurse because the goal if you are in a nursing school is to better prepare you to be a successful nurse. And then number six, you better off focusing on your comprehension than your grades. Grades should always come second only. Why? Whatever you've learned in your theory from your teacher, you should adapt it during your clinical exposure. Say, for example, on how to take care of patients with pulmonary edema. So, you learn it from your theory. So, you should adapt it when you are already clinically involved during your clinical rotation. That is very, very important. So, comprehension is very important. Now, it comes second on your grades. If you do well during your clinical exposure, then most likely you're gonna be getting good grades. So those are the six expectations that you will be having if you are in a nursing school. Thank you for listening. This is again your nurse.